Psychoanalysis is a type of psychological therapy that was developed by Sigmund Freud in the late 19th and early 20th centuries. It is based on the idea that our behavior and feelings are influenced by unconscious thoughts and emotions that have been repressed or forgotten. The goal of psychoanalysis is to help individuals bring these unconscious thoughts and emotions to the surface, examine them, and ultimately resolve them. Some key principles of psychoanalysis include the unconscious mind. Psychoanalysis emphasizes the importance of the unconscious mind in shaping our behavior, thoughts, and emotions. Freud believed that many of our thoughts and feelings are stored in the unconscious mind, and that we may not even be aware of them. The role of childhood experiences. Psychoanalysis places a great deal of emphasis on the role of childhood experiences in shaping our personalities and behaviors. Freud believed that our early experiences with our parents and other caregivers have a profound impact on our development. Defense mechanisms. Psychoanalysis also focuses on defense mechanisms, or ways that we unconsciously protect ourselves from painful or unpleasant experiences. Examples of defense mechanisms include repression, pushing unwanted thoughts or memories out of our consciousness, denial, refusing to acknowledge something that is true, and projection, attributing our own unacceptable thoughts or feelings to others. The therapeutic relationship. In psychoanalysis, the therapeutic relationship between the therapist and the patient is crucial. The therapist is seen as a neutral and non-judgmental listener who helps the patient explore their unconscious thoughts and emotions. Psychoanalysis typically involves regular sessions with a trained therapist over a period of several years. During these sessions, the patient is encouraged to talk freely about their thoughts, feelings, dreams, and memories. The therapist may also use techniques such as free association, encouraging the patient to say whatever comes to mind, and interpretation, helping the patient understand the underlying meaning of their thoughts and behaviors. Critics of psychoanalysis have argued that it is unscientific and that there is little evidence to support its effectiveness. However, proponents of psychoanalysis argue that it can be a powerful tool for gaining insight into one's own behavior and emotions, and that it can lead to significant personal growth and healing. The ID, ego, and superego are three concepts within Sigmund Freud's psychoanalytic theory of personality. These three concepts represent different parts of the human psyche that work together to shape our thoughts, behaviors, and emotions. The ID is the most primitive and instinctual part of the psyche, which operates on the pleasure principle. It is part of the psyche that seeks immediate gratification of our basic needs and desires, such as hunger, thirst, and sex. The ID operates on the unconscious level and is not influenced by morality or reality. It is impulsive and seeks pleasure without considering the consequences. The ego is the rational and logical part of the psyche, which operates on the reality principle. It seeks to satisfy the needs of the ID in a way that is realistic and socially acceptable. The ego is responsible for mediating between the ID and the external world, and it uses rational thinking, problem-solving and decision-making to do so. The ego operates on both the conscious and unconscious level. The superego is the moral and ethical part of the psyche, which operates on the idealistic principle. It represents our internalized sense of right and wrong, and it strives to uphold moral and ethical standards. The superego is influenced by societal values, cultural norms, and personal beliefs. It operates on both the conscious and unconscious level, and it can sometimes conflict with the ID and the ego. According to Freud, personality is the result of the dynamic interplay between these three parts of the psyche. The ID, ego, and superego are constantly in conflict, and the way in which they interact shapes our thoughts, behaviors, and emotions. Thanks for watching.